Being a dentist, I often have patients who are quite nervous or anxious about having their treatment. And one of the reasons is because they're worried about having a needle in their mouth, and obviously they're worried that it's going to hurt. Now, a lot of my patients who have Botox and fillers also have the same concerns because, let's face it, it's a needle that's going into the skin. So yes, they are very, very concerned. I have a lot of patients who are actually needle phobic, who when they come for treatment, they're actually very, very happy, and I've seen them time and time again, which is great. So in this video, I'm going to explain exactly how we make the process really, really comfortable for the patient, and also how we reduce or limit any discomfort or pain that the patient may feel. So before any injections are carried out, we would first do a face-to-face consultation. This is so I can determine, firstly, if you're suitable for the treatment, and secondly, to make sure that I understand what your main concerns are, and together we can come up with a treatment plan so we best meet your treatment goals. Now, we always give you time to think about this, so we wouldn't do any treatment on the day of your consultation. So we'll give you a cooling off period, and then at your next appointment, that's when we would be carrying out the treatment. So you've actually got time to consider the treatment, and you've got time to consider whether you want to proceed with it. So we would prescribe the product for you. Botox or botulinum toxin is a prescription only product, so only certain practitioners, dentists, doctors, prescribing nurses can actually prescribe the product for you. So this is prescribed, and when it's prescribed, it comes in a clear vial, and what we do is we dilute it with a bit of bacteriostatic saline, and we do specific dilution so it's the correct concentration for you, for your muscles, to get the wanted results that you desire. And so following your prescription, we would make sure that the environment is nice and hygienic for you. We would remove all of the makeup from the face, and then start proceeding with the injections. Now, the needles that I use are very, very, very narrow, very tiny needles that we use, so it's very, very comfortable for patients. The majority of my patients don't need any anaesthetic, topical anaesthetic, prior to having their treatment done. Those that are particularly nervous, we can put a bit of topical anaesthetic over the areas. However, the actual injections are pretty painless when you actually have them done. And the reason for that is because, well, firstly, when you do see a dentist, they are giving injections all the time. So they're very, very comfortable with holding a needle, with injecting a needle, and making it as painless as possible. Another thing is when we are injecting, as dentists, we're trained to be very, very balanced as well. This is one of the first things that we're actually taught in dental school. It's actually to have a finger rest. So when you've got a drill in your hand, when you've got a needle in your hand, you're always resting on something. So your hand is completely balanced, and your posture, everything else is really balanced as well. So your needle is not moving, your hand's not moving. So that's something that you need to be aware of when you're choosing your practitioner, because you don't want a practitioner who's coming to you with a shaky hand like that. Because yes, that's not going to be very comfortable for you, and it doesn't evoke a lot of trust in your practitioner. So you want someone who's going to be really, really balanced. They're very, very comfortable holding a needle, and they're using needles which are very, very narrow, very, very comfortable for the patient. Actually, the higher the gauge, so the gauge is the actual diameter of the needle, the narrower the needle is. And so I use a 32 gauge needle for my patients who have Botox treatment, which is very, very comfortable for them. And so in terms of the actual injection, like I said, very painless. If you do feel anything, you might feel a bit of a sting. It doesn't cause any discomfort when the actual fluid goes in. And the aftercare or after pain, majority of my patients, if not all of them, have no pain following the actual treatment. You may get a bit of a bruise following the treatment, so just be aware of when you're planning your Botox treatment to make sure that you haven't got anything booked in the day after, so you haven't got like a big wedding or a big party to go to the day after, because if you do get a bruise, sometimes if it's covered up with makeup, you still may be able to see it, so it's just something to be aware of. So in terms of your aftercare, You may get, like I said, a bit of a bruise. You may get a bit of a headache following the treatment. And this is usually because sort of 3 to 5 days afterwards, if you've never had Botox treatment before and the muscles are targeted, what will happen is your muscles are trying to make the movement, but they're unable to make the full movement that they're used to. And so this can sometimes cause a bit of a tension headache. So again, this is something to be aware of. It's not something that you need to contact your practitioner about unless you're really, really concerned. But sometimes a bit of a headache can be one of the issues after having Botox. So does Botox hurt? Not really. If you go to an experienced practitioner who knows how to inject and is using the right equipment, then no, Botox is actually very, very comfortable, and we make it super comfortable for patients.